Welcome back. Well, bladder incontinence can be very frustrating, especially when urine suddenly leaks during exercises, sneezing, even coughing. Well, don't let it embarrass you. It is more common than you think. Take a look. Hi, ladies. We're back at the Institute for Women's Health. And first, I got to let you know that November is Bladder Health Awareness Month. And with that, we came to visit Dr. Treszezamsky, and he's going to tell us about bladder health. How are you, doctor?
How are you, Claudia?
I'm well. Okay, so we were talking about how after a pregnancy, it's very important that you take care of yourself as well, because bladder problems kind of start to surface at that time. Tell me a little bit about that.
That's right. It's true that a lot of times the problems of the bladder, going more frequently or leaking urine during the pregnancy, goes away after pregnancy. In a good number of women, those problems persist, and it's not necessarily that they're going to go away on their own. So I think it's a good idea, especially after childbirth, for women to have the opportunity to talk to their obstetrician gynecologist about these urinary problems, because there are a lot of options available to them, and not necessarily surgery, that can be done, can be tried to help them with their bladder problems.
I'm so glad you say that, because I think a lot of women may also say, oh, well, it's part of the pregnancy, it's going to go away. But it could be a condition, and it could be something that you could take care of. Tell me a little bit about what the treatments are for a problem like this.
The most common type of incontinence in young women, especially after childbirth, is called stress urine incontinence, which is the leaking of urine that occurs after certain movements or certain activities that briefly push on the bladder. That's what's called stress. They stress on the bladder briefly. And so women typically complain of leaking urine with coughing, with sneezing, with laughing. In a lot of cases, that's what prevents them from being more active, and that embarrasses them and makes them unhappy. There's different kinds of treatments. The first kind of treatment is to try to strengthen the muscles that are weak and that lead to this problem. Most women have heard about the Kegel exercises. There are other options. There's physical therapists who specialize in pelvic floor and in strengthening those muscles with some techniques. One of them is called biofeedback, where actually the patient can see that muscle in action. There's devices called pessaries that are inserted inside the vagina, very much the way like a diaphragm or a tampon, and they're designed to give the bladder and the urethra support so that it can contain the urine when needed. And there's a host of surgeries that can be done to treat this problem. Basically,
the point is that it can happen to women, young, older, it doesn't matter. As long as if you've had a pregnancy, you're past the pregnancy, you still feel you're not able to contain your urine during certain activities, then there's a problem there. But the good news is that there's treatment for it, and the best thing for you to do is to come get it checked out. Thank you so much, Dr. Treszezamsky.
You're very welcome, Claudia.
Very interesting. The Institute for Women's Health is on Hardy Oak Boulevard in Stone Oak, Suite 230. They got other locations available. Give them a call at 494-2000. Check them out online, ifwh.org. They have a Facebook, Institute for Women's Health, or Twitter at IFWHSA. Okay, so who's